Hello everyone and welcome back to my channel. Myself Dr. Surbisani. Hope you are doing great. Now today I come forward to talk about the second video regarding the important topics of the different subjects which come under the NEET MDS preparation. So it's my humble request that you can watch this video till the end, because this video is very important as we have a very less number of time for the preparation of NEET MDS 2024. So I have already done the past 4-5 years papers analysis, and now I am telling you the list of the important topics of different subjects. So at least minimum topics which you should cover, right? So the subject with the important topics is the general medicine. The first important topic is the acute kidney failure, second gonorrhea, third cholera, fourth infective endocarditis, fifth tuberculosis, sixth cerebral palsy, seventh typhoid fever, eighth syphilis, ninth diabetes mellitus, 10th trigeminal neuralgia, aortic regurgitation, glossopharyngeal neuralgia, auriculotemporal syndrome, lower motor neuron, Legionnaire's disease, enteric fever, chronic obstructive pulmonary disease, Wernicke-Korsakoff syndrome, acute pancreatitis, diabetic neuropathy, leprosy, nephritic syndrome, and serum cardiac biomarker. Now the important topics of the general surgery subject is comparatively minimum topic are there as compared to the general medicine. So the general surgery important topics are the tracheostomy tube, left gastric vein, oroenteral fistula, hemangioma, shock, edema, suture material, intranasal antrostomy, cystic hygroma, retromolar trigon, wound healing, palentoplasty. And for the journal pathology which you read in second year of the dentistry, there are only 4-5 topics. One is the cell injury, second anemia, third one is the transudate and exudate, fourth one is the necrosis, and fifth one is the leukemia. Followed by for the microbiology, again a second year subject of dentistry, the important topic is the dimorphic fungi, Shigella, Staphylococcus, and true yeast. Followed by the important topics from the physiology from the last 5-year paper analysis, that is for the physiology subject which you read in first year of the dentistry, that include aldosterone, carbon cycle, RNA, jaundice, Broca's area, renal tubular function, exocrine gland, dorsal and ventral group of respiratory neurons. Now the important topics of anatomy is danger space, pharyngeal arches, kidney, oesophagus, larynx, pharynx, tongue, muscle of mastication. Followed by the public health dentistry or the community dentistry, we can say the important topics are specificity, yield, TFI index, errors, sampling, incremental care, bias, capitation plan, web of causation, non-parametric test with one way, ANOVA, crucial vallis, case in epidemiology, fluoride prevention, OHIS index, EMF index, sodium fluoride, student T set, CHI square test, crossover type study design. Now the important topics of the oral surgery from the last 3-4 years paper analysis, the important topics which we have come across is neuroma, ankylosis, Go-Gates technique, pterygoid space infection, extraction, fracture, TMJ, anthrocentosis, and local anesthesia. And radiology, the important case-based and X-ray based question is on the internal resorption. Artifact question is there, double image based question is there whose answer is the double image, followed by another image based question in which you have to point out the nutrient canals, followed by another image-based question for the anterior nasal spine. Next is the osteoradionecrosis. Followed by the pharma topics are antibiotics, beta blocker, acute iron poisoning, clinical trial phase, furosemide, anti-cancer drug, valproate, adenosine, thanis gravis, penicillamine, niacin deficiency, diuretics, alpha blockers, opioids, antithyroid drugs, antipsychotic drugs. Different topics of the endodontics and conservative dentistry, that is the acute apical abscess, tooth preparation using ear abrasion, Gates Glidden drill, that means question on the GG drill, followed by the law of excess opening, smart preparation burrs, primary retention form for amalgam restoration, sodium hypochlorite, dentine bonding agent, pulp protection, EDTA, ICDAS, that is the International Caries Detection and Assessment System, Keyes triad of dental caries, Ellis and Dewey classification, amorphous calcium phosphate, digital imaging fibro-optic transillumination, Wine classification, isthmus classification by Kim and colleagues. Followed by the next important topics list, that is of the subject of periodontology, that include MC-Cal festoons, PDL, dental calculus, conjugation, TFO, that is trauma from occlusion, modifies pen grasp, chronic periodontitis, tuberous sclerosis, Marin classification, gingiva, local aggressive periodontitis, drug-induced periodontitis, plaque, ENUG, brushing technique, Glickman's classification of furcation, gingivitis, drug-induced periodontitis, gingivectomy knives. Now the last subject important topic list are the ortho and pedo, that include almost these two subjects have a similar topics which are in common, and that's why I have fabricated one list for the ortho and pedo subject, that include lingual arch space maintainer, skeletal class 3 malocclusion, spacing, tooth movement, cleft lip and cleft palate, image based question on distal shoe, servo system theory, class 1 div 2 malocclusion, image based question on the pre-ortho application, K-loop molar distalizing appliance, angles classification, IoT and dental health component, fixed orthodontic retainer, curve is there, followed by the class 3 malocclusion, ugly duckling stage. So these are the topic of orthodontics. Followed by the periodontics topics are the chalky white spot lesion, intrusion, serial extraction, early nursing caries, pulpectomy, hierarchy of needs, image-based question on the acute herpetic gingivostomatitis, as well as the clinical based question come on the same topic, that is the acute herpetic gingivostomatitis, classical conditioning, modified periodontic triangle, film survey, preventive resin restoration, apexogenesis and behavior management. That's all about the today's video regarding the important question list which come from the past 5 years paper analysis of NEET MDS examination. Although we have 10 to 12 years of the past papers, that too with solution, that too in the PDF form, that too of the NEET MDS. So if you want that, either you can drop me the mail which is shown on your screen, or you can follow me on my Instagram ID which is shown on your screen, and you can ask for the NEET MDS past paper PDF. Definitely it's a paid PDF set, so you will get it on your WhatsApp. Followed by that, there is one small pro tip. Along with the topics and along with the past papers of NEET MDS, at least do the past papers of INI CET, because that paper contained more of the clinical questions. And nowadays, if we see the scenario of the past papers, mostly the clinical based questions are coming and they are asking in the exam. So that's why Don't forget to go through the INI CET past papers. 5 years set of INI CET past paper with complete explanation is available in the PDF form. So for that you can contact me by any of the mode. That's all for the today's video. Thank you for watching and all the best for your preparation.